This video was shot on location at Ulwazi Place, where business meets comfort and serenity. Welcome to another episode of the Decolonizing Global Health podcast, a product of the African Population and Health Research Center. I'm your host, Michelle Nguthia, and today I'm joined by Dr. Estelle Sidze, a leading researcher on maternal, newborn, and child health at the African Population and Health Research Center. Dr. Estelle, over to you.
Thank you, Michelle, and thank you for having me. My name is Estelle Sidze, Dr. Sidze. I work as a senior researcher at APHRC, but beyond being a researcher, I'm also a mother. And I work at the center with a team of researchers with the vision to transform lives in Africa, especially in the area of women's health. And we're working principally on a number of projects that we're implementing across different countries, 26 countries in Sub-Saharan Africa right now, to advance coverage and equity.
Okay, so let's get right into it. From your perspective as a top researcher, what are some of the most pressing challenges when it comes to maternal health?
Yeah, thank you, Michelle. But before we start touching on challenges, I think it's really important to highlight the fact that we've made a tremendous progress as a region in terms of improving the life, the health of the mothers and newborn and children. Mm-hmm. So we have to really tap ourselves on the shoulders for that and thank the commitment that our countries have in terms of improving funding, but also improving implementation of interventions, life-saving interventions like antenatal care, postnatal care, and this has really led to improvement in the main indicators that we're tracking over the years. But of course, as we tap ourselves on the shoulders, we know that there's still remaining challenges that we need to address. And some of them mainly are linked to issues around coverage and equity, issues that APHRC really want to tackle. Mm-hmm. We know that not all the women have access to life-saving interventions right now. Not all women have access to antenatal care, to skilled delivery, to postnatal care, or even immunization for children. And we know those are very important to save lives. So what we're trying to do as a center, at least, is how do we engage policymakers? How do we generate more evidence in terms of really better understand equity issues, but also working with policymakers to craft some solution to address these equity issues. And if we just talk about the no one left behind, this is something that is discussed now. Mm. And when we look at the different populations right now, there are pockets of women and children that are left behind. And these are women especially living in urban slums in Africa. And we know with urbanization in Africa, the slums are increasing, and mothers and children who live in those slums are highly disadvantaged. Mm. They don't have access to quality services. So this is a particular population that needs a lot of attention right now. We also have women and children living in arid and semi-arid areas across the continent, so the whole Sahel area. Very challenging environment, and now with issues related to climate change, and they're even more vulnerable and marginalized. And those we need more effort for them to not be left behind and really access quality services. And of course, a particular group that come in mind are women and children living in humanitarian settings. They also have to receive appropriate care, timely care, and continue working on innovative interventions to reach all of those populations. Mm-hmm. Is what we need to focus on now. Of course, beyond the geographies and the women at risk, there's still a lot of health system issues. We know that the workforce is still not adequate. The density of nurses by population is still far behind what we expect to see within the continent. Technology, drugs, a lot of regions still, countries still struggle with having the commodities that they need for taking care of children and mothers adequately. And I think it's also important to mention three of the main challenges that we really need to focus on right now in the region. So the first one is really in terms of those illnesses that make the life of mothers and children complicated on the continent. And the first one is malaria. And malaria is a challenge that we had for years now, and that we're still not addressing. And we know what needed to do to prevent malaria for women. We've talked about it for years. Mosquito net, impregnated one, making sure the sanitation is ensured. But still, we're losing 10,000 women every year still because of malaria on the continent. And malaria kills almost 20% of children within the neonatal period. So we need to address the issue of malaria. And now you see also issue related to hypertensive disorders. Almost 20% of the death of mothers that we registered now in the region is because of hypertensive disorders. And it's not reducing. The proportion is not reducing. And again, there also we have technologies that help, that have been devised, that can help just assessing the blood pressure of women, helping them the education, helping them taking the pressure and making sure that this is treated accordingly. But again, as I said, not all women have a chance to access those technologies, so we need to scale up those kind of interventions. Unfortunately, we're still losing women, a lot of women, because of hypertensive disorders, and of course. The issue of climate change, we cannot discuss and forget the issue of climate change. If you, as I said, populations like living in semi-arid and arid areas, as I said, the challenge now is basically increasing temperatures for those women. So we really have to keep on working, especially in the region, to generate evidence on the real impact of climate change on women and children. This is evidence that we don't really have on the continent, and this is something that our policymakers and stakeholders and like-minded institutions that fund our research needs to focus on.
Okay. It's interesting that you've mentioned evidence, the need for evidence in tackling all those changes that you outlined. And as a researcher, that's the bulk of your work, basically, to generate evidence. So what are some of the things that you've been able to find that have been most impactful in advocating towards greater investments for maternal health, especially in line with the recent changes that have been happening? He mentioned malaria as one of the things that affects maternal health, but we've had funding cuts. So what are some of the findings that you've had or you helped to unearth that have made or have gone a long way in advocating?
I think this is an interesting question. I've learned with my years of experiences, especially the years that I've spent at APHRC, that the evidence we need it's not really the findings from our research, but it is evidence, like turning our findings into actionable insights for stakeholders. This is what we need as researchers. The so what, answering the so what, because I've over my 14 years of research experiences and engagement with stakeholders. I've come to realize sometimes we develop nice product. We always say researchers, they develop reports, 100 pages, and peer review papers that they're so proud of, and then this is just collecting dust on the shelves. Yeah. But I think for me, it's just like, perhaps what I think we need to do is really learn the art of turning findings into actionable insights for stakeholders. So the whole evidence-informed decision-making process needs to happen, and it needs to happen perhaps urgently in the region, as you say, because of those funding cuts. So we have to be able to find ways to help our stakeholders within the continent to see what are some of those key opportunities that they can fund with the limited resources that they have, that can make the biggest change within the health field. And we have to be able to basically showcase that. We have to be able to cost it. We have to be able to guide them. So, as I say, I've learned with my years of experience that just publishing papers or just writing reports is not perhaps what is necessary to make the biggest case for investment. So we need to really work on actionable evidence. And also, what I've realized with my years of engagement, I worked recently, if I give an example, on Nawiri, USAID Nawiri national study, where we were looking at the household dynamics of children health and nutrition. And this is in semi-arid areas of Kenya, so the county of Turkana and Samburu. And we had, during the 2 years period, intensive engagement with the leadership of those counties. And for me, it was was really also a learning experience to understand what type of evidence the policymakers want, what kind of critical information they want, and be able to having those pause and reflect sessions with them, be able to go back again, retrench and go back with communication specialists or policy engagement specialists at the center to really chew down the data that we have to turn it in actionable insight. I think for me was a very, very great experience. And I remember the last meeting that we had in APHRC with the stakeholders, and just seeing the appreciation that they had in terms of, now we understand what we can do for our mothers and children. Now we know and we understand maybe the alternative ways of addressing the persistent issue of malnutrition in these communities. Just seeing that appreciation for me was very rewarding. I can also give the example of a project that we've been running at APHRC for the past 6 years now, the Countdown to 2030 initiative, so tracking progress for reproductive, maternal, newborn and child healthcare indicators in Africa. And it's a project that we're implementing in partnership with University of Manitoba and John Hopkins University and many other universities who help us in with technical support. And we work with 26 countries, with stakeholders at a high level in the Ministry of Health and research institution and National Institute of Statistics. And also within those regional meetings that we have with those stakeholders, we understood the need to go closer to stakeholders with evidence, like really holding the hand and walking through the evidence, and also walking through that pathways of decision making. And I think perhaps as a background for the countdown, when we APHRC decided to take the leadership on the countdown, our vision was really to not have just reports that are globally produced, indicators that are tracked for Africa and on behalf of African countries, was really to have them taking the driving seat in terms of even understanding those indicators, choosing the one that works best for them, but also be able to know how data, those big data sets that we use in the demographic and health survey data or the routine data that we collect from the Ministry of Health desk, how can you use it actually to inform the actions, to understand the status and also inform action. And it has been a great experience. And also there we see every time we have an annual meeting with those 26 countries representative, there's also a lot of appreciation of what we have been able to achieve with them.
Yeah. It's interesting that you mentioned the Countdown to 2030 project. And just before we started, we were talking about how 2030 is not really that far off. It's actually just 5 years. And I guess everyone across the world, especially those who are pegging their projects against the SDG, should be actually working towards the home stretch. So then that makes me question, you've done all this work, 14 years, and it's not just you. I mean, the center has been running even for that. What other gaps are there in terms of maternal health research, and where should future research essentially on maternal health, maternal newborn child health look at? Where should the target be?
Yeah, this is a very important question. I think maybe picking from your last question in terms of the key things now is solutions. What can we do? What are some of those rightful interventions? Because we know the problem, we know the issue, we're tracking progress, and we know why countries are not making progress. And as I say, it's mostly around coverage and equity indicators, because as I say, we have the life-saving interventions. Yeah. We know ANC, antenatal care save life. We know skill delivery save life. We know that if children have access to the immunization as per the schedule, that is, it saves lives. Mm-hmm. Maternal vaccines, we know that they save lives. But again, not all women have access to those different interventions. Mm-hmm. So really, for us as a center, at least recently, we discuss around two main things. So the first thing in terms of how do we generate evidence that can help the region or help countries or decision makers to actually know how to scale up those life-saving interventions. That's a critical piece of evidence. And this is can be around all the type of interventions, but there can just be specific intervention. As I mentioned, malaria, that is still killing a lot of women. Climate change is now in the mix of all of these issues that we have. But also, as I say, hypertensive disorders, if we just focus on how do you end preventable maternal death by actually scaling up life-saving technology for hypertensive disorders is already a big thing. So we need to have researchers or evidence generators that really focus now not on reinventing the wheel, but really to understand the things we know now and the solutions we now have. How can they be scaled up? And for doing that, we need implementation research. So it's not really basic research, but really implementation research. How do you move having life-saving tools for hypertensive disorders in Accra, for example, in Ghana, in the main city, to other regions of Ghana, or I don't know, in Kano State in Nigeria, to move it to another states. And if you come to Kenya, how do we move access to it in main hospitals in Nairobi, in other states, and the region of the country? So really, we need implementation research. This is a critical gap. And then the second thing that I will say that we need is really we need to have a place where we host knowledge on what we know, on what we can do in the region. And I will say that it's perhaps for me a big gap is that we don't have a strong center of excellence research on maternal and newborn and child health within the region. We know that Makerere University, for example, I've piloted and implemented one, but the support that the region is putting within making that center of excellence, a center where we can, gather data that country can use, lessons learned on, solutions that work and on scaling up, implementation science kind of evidence. It has to be hosted somewhere. It has to be accessible for all the countries. So I think these are the two gaps that I think we need to address as evidence generator now in the continent.
Okay, I hear that. But there's also something else we can't leave without discussing, which is mental health. And in your case, it would be maternal mental health. So this conversation would be remiss if we just went away without discussing that. Perhaps you can speak to what's inspired your interest, because that's something that we've been seeing in the recent past in terms of your research. But generally, mental health has become something that is more common. People are opening up towards speaking about it. Perhaps you can speak to us about those intersectionalities. And is it one of those gap areas that we should be looking at moving forward?
Yeah, you're talking about mental health, and you really it's something that is very is very dear to my heart. Maternal mental health, I would say it's an elephant in the room within the maternal, newborn and child health field. We know with data that 1 in 4 women in Africa, 1 in 4, and in some countries 1 in 2. Countries like Burkina Faso, we have a prevalent study that shows us 40% of women who are at risk of perinatal depression. So we know with evidence that women have emotional issues around their perinatal period, but this is not addressed. Of course, a number of countries, especially in the East African region, have made sure that the policies that are related to maternal, newborn and child health have some mental health components, but policies in some countries remain policies. They are not implemented. WHO have worked with countries across the region to develop guidelines in terms of integration of maternal mental health services at primary healthcare level, but not a lot of countries are even trying and piloting and making sure this work. And we understand when we interact with countries that there's a lot of challenges to make that work, because mental health itself, not just mental health of mothers, is not something that we prioritize in a lot of African countries. And integrating something at primary care level means you need to have the necessary workforce. So you need, for example, a mother to go to a health facility and have access to a nurse or midwife who is trained in terms of maternal care, but who is able to refer her to somebody, a specialist that is trained for mental health care. So if that does not exist, of course, the possibilities of referrals and treatment cannot happen. But I think it's not just a health system issue, unfortunately, the maternal mental health on the continent, but also a cultural kind of issue. We do not talk that much about it. And if we don't talk about it and we don't advocate for mothers, also the pressure on our system or the pressure on stakeholders will not happen. So the advocacy part, even from the communities and from researchers, has to be something. Of course, we're developing as researcher pieces for call of actions and all of those journals and all that. But within the communities, for me, at least from my experience, I think we need to even change the way people see mental health, the stigma that surrounds mothers. I've been working the past 2 years with a cohort of 1,200 women within a study that we have funded by NIH called JAMO Project, where we follow women asking questions every 6 months. And we have now 6 waves of data collection that shows that it's a huge issue. Mental health is a huge issue among those women. And if you see women that we've seen at different waves that are severely depressed, we don't see changes in subsequent wave. And when we're asking to those women, have they stopped? Because we give them referrals, but they tell back to us in our qualitative interviews with them is, it's good to have referrals, but I cannot get services because if you refer me to Kenyatta Hospital or not, the services are not free. So somebody has to make those services free. But at the same time, when you also discuss with women through qualitative research, you realize that one of the biggest hindrance in terms of addressing the needs of women is actually our norms, our cultural norms, the mental health norms that we have in society. Most women will tell you, and it's not just us, our mothers, our grandmothers have said the same thing. Pregnancy is not something that women should be complaining about. We are strong women. African women are strong women. They should not complain about, the process of being pregnant or the delivery process. They have to go through the process. You're not the first one. You're not the first one to push a baby, and you're not the last. So most women, when they're struggling with postpartum blues or depression, they're not asking for help. They don't even voice it, which is unfortunate. They don't even voice it. And we need to make that change. And with its education in the communities and even the support system among the women to understand that they have to watch out for some of those signs of depression among women. And our evidence again has shown that women who are depressed are not able to take care of themselves, are not able to adhere to services that you ask them, postnatal care services. They are not able to breastfeed. So meaning even the implications of women not being well is actually expands beyond themselves to the children and the family. So we really have to take care of that within the community and change the perception and the norms around maternal mental health. As a center, we've partnered with a number of networks, including the United for Global Mental Health network. We want to be able at a high level to run as many webinars that we can to actually raise, the attention or even the alarm around taking care of these issues. As I always said, we've made sure that African women survive. It's time to make them thrive. Yeah, so we have to make sure that the women thrive, not just survive through the process of delivery. They have to thrive and they have to be happy to be mothers.
I need you to say that again. For African women to
thrive. We need
them to survive.
Yeah.
Fantastic. I like that. So we're coming towards the end. And this year's World Health Day, the theme is on maternal health and rights. So if you were to have a minute or two to speak to key decision makers, either policymakers or funders, what is the one thing that you'd want them to take away in terms of the role for the short-term, medium, long-term future on maternal health?
Yeah, I like the question. And when I'm always in debate regionally, internationally, I always say one thing, especially to stakeholders. Giving birth in Africa is like going to war. And they have to be aware of that. As I said at the beginning, I'm also a mother, an African mother. Giving birth is not an easy process. And for most women, as I say, it's basically a battlefield within our regions. And it should not be like that. Women should not be afraid to lose their life while being pregnant and giving birth. So we have to really understand that we have policymakers, that you have a commitment to making sure that women survive and thrive within this process. And as we say, it's a human rights issue, but it's also a gender issue because women carry the responsibilities of giving birth and giving birth to citizens of our countries. So they should not bear the burden of paying for their lives to do so. So policymakers have to understand that they have to live out to this commitment. giving birth should not be a battlefield. Women should not die because they're giving birth. So as I say, there's a lot of work and evidence that we generated about life savings interventions. So it's just a matter of putting this to scale. And we know countries or policymakers, when we're engaging them, even within the Countdown to 2030 initiative that we run, they'll tell you there's no resources. But I'm sure there's ways to have, craft some, innovative way of addressing things that, can be funded within our region. Because as I said, no woman should die when giving birth, and no woman should die while giving birth to a citizen of a country. So we really have to take that seriously and to make sure that we push the envelope and the boundaries in terms of addressing these issues that we have at hand.
Okay. So that's it for us for today. Thank you very much, Estelle. My main takeaway is African women, for them to thrive, they need to survive. Thrive to survive. So until next time, thank you very much.
Thank you.
And that's it from us at the Decolonizing Global Health podcast. Look out for our next episode.